going to have a bash at describing this case study to you, and I hope that you can get the essence of it, because it was very much, although there was some practical input, it was very much on an emotional level. Now here we are, we have a couple, Sarah and Mike, quite delightful couple, and they have very kindly, with their blessings, allowed me to present this case to you today. And they actually had 2 separate referrals to me for 2 different cats. And I'm going to talk just briefly about the first one, so just to set the scene of what was happening here. First referral, Cuddles. And Cuddles was referred for aggressive behaviour. 2-year-old domestic short hair, spayed female, adopted by the couple at the age of 18 months. And health check, fit as a fiddle, nothing wrong with this cat at all. Now, just to sort of give you an overview, and I love these Google Maps because it allows you to sit down with the owners and look at the surrounding area and plot where the cats are and think, wow, a lot of cats, not much space. So that's just a sort of quick sort of sneak of a Google map of where they live. And very, very built-up area, back-to-back residential roads and gardens. Their gardens sort of had a raised decking outside that fell down towards the valley, and masses of cats in the area, a very high cat population, lots of fighting. Not necessarily all Cuddles, but lots of fighting going on. There's lots of cat screaming going on at night and so on. And this is just an extract. There's going to be quite a few email extracts from Sarah, because she liked to process her thoughts very openly and often on paper. Here we are, this is before I went to see her. Whenever I was in my dressing gown, that's Cuddles, would snuggle right up to me. Gradually, she did this less and became irritated by my attempt to stroke her. Okay? This resulted in swipes with her claws out and bites. I have become better at reading her body language, but now, 2 months in, the bites are coming out of nowhere. Well, do you know, I should never make any hard and fast assumptions when I read emails from clients, but I'm sort of thinking, oh, interesting. Sounds a bit intense. And, you know, she says, I'm getting better at reading her body language, but she's still biting me. And I'm thinking, well, okay, but I wonder whether you're reading it well enough. Here we go, another one. I will be able to pet Cuddles, and she will appear happy, rubbing her scent on me with her hand and tail, and this will get less. And just as I start, at this point, I'm saying, stop. Don't do it anymore. That was lovely. That was perfect in the moment. Stop. No. Just as I start to feel confident that we are getting somewhere, I sense a change in her. She even looks different usually. Still she's stroking. And I'm thinking, okay, well, there's a signal there that maybe Sarah isn't reading. Now, this is very interesting. Another email just prior to my visit. I am becoming afraid of my own cat and feel that we will never be able to have a relaxed home again unless I let her go. Now again, I'm not going to make any assumptions, but I'm going to keep something in the back of my mind, and this tells me on a gut level, here is a person that's suffering from that all too common, terrible ambivalence. I don't want to live like this anymore. I can't. I'm frightened in my own home. This isn't what I bought into. I wanted a cat to cuddle, hence the name. Cuddles, this is what I want from this cat. And yet this cat is not fulfilling what it says on the box, so I want to get rid of the cat, but I don't want to feel the discomfort and guilt and the judgment from others about getting rid of a cat. So there's that awful sort of emotional ambivalence. Okay, so she completed a pre-consultation questionnaire as any other client would about her and her family, the cats, any other pets, in this case, no other pets, the environment, lifestyle, diet, and the problem, historical and how it is currently. And then the next stage is the home visit. Now, during the home visit, I take every opportunity to listen, to observe, and to observe the relationship between the cat and the owner, and between the cat and me, and the cat and its environment. And from the history taken, and from my observations, it was quite clear that Cuddles was not cuddly. She didn't really get the whole people thing. People were facilitators to make good things happen, but in themselves, they were not much. And Cuddles had a much bigger issue going on. Cuddles spent the whole time I was there with her back to us, facing the outdoors. The only time she moved away from that was to go upstairs to the back bedroom and look outdoors from the windowsill. But even as she passed through, Sarah could not resist, draping her hand over her as she walked past and talking to her and constantly sort of looking at her when she was at the back window. So there was an interactive style of this high frequency, high intensity that didn't really suit Cuddles at all. And there was that persistent focus. And Cuddles' response was, "Get away from me, woman." And she learnt to use teeth, claws, whatever it took to get that point across. And she was getting there, but it was hard work. The other thing, of course, that was very telling, that Sarah said the worst injury she got was when Cuddles was coming back inside after a very hard day in the territory, and she'd do her, "Oh, coochie, coochie," whack. That's when Cuddles was really saying, "For goodness sake, give me some space. I've had a rotten day out there." So big pressure from outside. Cuddles was struggling with that. Actually, Cuddles was failing in reality. Her territory was shrinking. I think by the time we decided to call it a day, she had half the decking outside in the garden. And there was just a row of cats just waiting to engulf her. Now, you'll notice I've given the game away a bit there. At this point, normally, I would do a behaviour modification programme. But we had this big problem here, and it's something I haven't mentioned up to this point. But Sarah was very poorly. She'd been off work for quite a long time, and she had various immune system issues. And the stress of these conditions and the injuries had meant that her health had deteriorated significantly. So where was I going to go with that? We decided, and I say we, I mean this decision had to come from her, but we talked through all her options, that really, do you know what, Cuddles was struggling? She was struggling. Let's see if we can't care about Cuddles and let her go. Now, in these situations, I know this is going to be quite horrific to some people that think, well, crikey, that's a very difficult thing to do. And Sarah was very courageous. If I ever have a situation where a client has to do this, then I will help them. I work with an excellent animal charity. She was whisked off to a fantastic foster home. We decided exactly what sort of home she should go to, and she found it. And then when this happens in cases, I wait until we get a report from the new home with a photograph. That goes back to the previous owner, and that just confirms to them that this was absolutely the right thing to do. And this is the picture that went back. This is Cuddles renamed as Megs. So telling. And interestingly, and this is Wood Green, fantastic at finding the right homes, she went to a man on his own in a low cat density area. Men's interactive style generally, I mean this is a whole different talk itself, tends to be less intense. Here we are, Megs. It's just brilliant, totally adorable and loving, can't believe she ever had any issues. So that's a sort of happy ending to that story. And then Sarah got a second cat very quickly. Now, we had spoken about this and we talked about, well, you know, what about, she said, I need to have a cat, that's fine. But let's not impose your relationship style now, which is all about being quite scared of cats, onto a new cat. Because, you know, that had dangers. But she couldn't wait, and it's entirely her prerogative. So she did a bit of a cat swap. She went in with one and came out with another. This one, absolutely assessed as being bomb-proof. Bomb-proof. Well, so we carried on. Sarah sought advice from me, which basically involved chatting about it and just talking things through about losing Cuddles, which still she had these feelings of guilt and loss, and that was perfectly understandable. She needed to talk those through. And building confidence with the new cat, because surprise, surprise, she was finding that quite difficult. Will this cat bite me? And then things tailed down and things seemed to be okay, and I didn't hear from her for a while. But 18 months later, This is the email I got. I will read it. I applied her spot on. That's the flea treatment on the back of her neck. And that's when her current behavioural issues began. I've never done anything to her with regards to the usual routine maintenance on my own before. I have always done it with Mike on account that it requires both of us. At this point, I'm quite scared. Probably due to this, she is usually wary of Mike when he enters the house from work. When I applied the spot on, it was as if everything froze. I can still see the shocked body language she displayed, dilated pupils, and for a few seconds she just looked at me shocked. And I imagine my face to her is a similar story. Second referral. Mew, here she is, was referred to me for sudden onset acute anxiety, acutely anxious behaviour. She was hiding under the bed, she was hiding wherever she could hide, she wasn't coming out, she was very fearful, and Sarah was distraught. Went through the usual pre-consultation questionnaire. There she is, Mew, or Mew, as she called it, it's just a bit too much. 3.5-year-old domestic short hair, spayed female, adopted at 18 months before, at 2 years of age. Health-wise, spot on. Now, when I did the home visit, it was quite extraordinary what had actually occurred here. And when you unpacked all that thing about, I never do anything with her unless there's two of us, pin her down, routine maintenance and everything, she was describing the most extraordinary monthly cycle. And that monthly cycle was her levels of anxiety. That peaked on a particular date of the month. Surprise, surprise, that was spot on application date. Carried on a fairly high level, dipped about 2 weeks after, only to build up again to form another peak 4 weeks after the previous one. And what we were seeing here was an extraordinary positive feedback loop. As Sarah's anxiety heightened in anticipation of the spot-on day, the cat was saying, what's going on, what's going on? You look dangerous. You look very unpredictable and threatening. Suddenly the incident occurs. Well, as far as Mew is concerned, she's going to die. And then Mew takes 2 weeks after that to recover from this. And Sarah takes 2 weeks to come down from the guilt of what she's done to her cat. It was an absolutely appalling cycle of unpleasantness. And Sarah was unhappy as I'd ever seen her be. So, I put in a behaviour modification programme. And, I'll word these any way I need to be honest, because if I'm in the owner's frame of reference, then I'll use the language that works for them to get the point across. And the first thing we talked about is, do you know what, give her time out. Let's stop this. Actually, the first thing we talked about was let's stop the spot on, but I'll come to that in a minute. Give Mew a cloak of invisibility. Now, that's sort of a code way of saying ignore your cat. Trouble with saying ignore your cat, you get one of two things sometimes. You get the cat coming in and the owner's saying, now, I'm ignoring you, so don't you, that's not cutting it. Or the cat comes into the room and the owner goes, oh, the cat has come in the room. That doesn't look so good either. So I thought, come on, a bit Harry Potter-esque, let's give the cat a cloak of invisibility. Some people like a camouflage blanket. I don't care what it takes up here for it to work. So what you basically do is you have no cat. There is no cat, the cat is invisible. The only time you have a cat is when that cat comes round somehow, and cats will, you know that cats, if they want your attention, they'll ask for it, comes into your area of awareness and says, I need something. So she said, yes, okay, I sort of get that. Feels a bit neglectful, so we talked about that. And then I said, right, if she directly asks something of you, then give it, and then wait for the next instruction. What I wanted to happen was I wanted to create this sort of dance where the cat moved, and the owner moved, and then waited for the cat to move again, rather than the owner moved and went off in her own fair way. So it was all about always following the lead of the cat and giving a little bit and then saying, right, your next instruction. Yep, she got that. And the next thing, which is quite funny really when you think about it, concentrate on genuinely feeling relaxed. It's crazy. So we said, okay, that's a bit hard as an instruction because it's counterproductive. So we decided, no, okay, we're going to talk about being with the cat rather than doing to the cat. She said, yeah, I get that. So sort of cohabiting. Yep, go about your business, be with your cat, don't do stuff. Yep, that makes sense. And we reviewed that, and this is a big part of it. We reviewed that flea and worming control. So no more routine maintenance that involved all these sort of dreadful things. We very low key, and the vet did a lot of it, and that really, well, the monthly cycle, that immediately was abandoned, which is wonderful. And this is the thing that's so hard to get across. There was a lot of additional dialogue here as well. And this additional dialogue was important for her to feel what she was saying. Because all of you probably know you can't fake it with a cat. You have to really believe what you're doing, because the cat's very good at buying into fakery. If you're not being genuine, the cat will work it out. So she had to really adopt these beliefs. And I don't know whether it's fortunately or unfortunately, but she was a psychotherapist by profession. So she was very good at self-analysis. She was very good at thinking things through and exploring her thoughts with another. And so she wanted to talk from a frame of reference of cognitive behavioural therapy. So we talked about irrational beliefs and thoughts and feelings and behaviour and how they all interact. She even wanted to talk about developmental psychology. She wanted to talk about a psychoanalyst called Donald Winnicott, who spoke about the good enough mother. And I thought, yeah, this works. Basically what Winnicott was saying, that you know, you can mother too conscientiously, and sometimes it's okay to be good enough. And we thought, well, I wonder what good enough cat care would look like. And so she explored that, and she thought, yeah, I sort of like it, because I've bought into Winnicott's theory about rearing children, so this works for me, whatever it takes. And this is a beautiful picture of Sarah and Mew being. Very relaxing. So here we are, 5 days after the consultation. We've already got a bit of a eureka moment here. The more I'm learning, I'm realising I've been tying myself up in knots through fear that my relationship with Mew might be damaged if I did something wrong. I so wanted to get it all just right this time that I ran a real risk of it being the opposite of my intended desired outcome. And I see this phenomenon so regularly. I just want to do what's right, and actually you end up with the complete opposite outcome. 25 days later, still giving the cloak of invisibility, still responding to Mew in a gentle way. I do feel extremely privileged to witness her growing individuality and just being. She's really bought into the being thing in the moment. It's fantastic. Let's just do what she wants to do, and the freedom of doing the same. She's getting something out of this because the pressure of doing the right thing has disappeared. You could not explain to someone the feeling it gives when embracing that independence does not make her love you any less. And this is wonderful. This is all stuff she needs to absorb as a belief, because this will all relate to the relationship with Mew. A month afterwards, I mean, this is a lovely example of the dance. Her and Mew became a very good dancing team. Later today, Mew jumped on the sofa and head-butted my hand very lightly. I didn't pet her, as I wanted her to be a little more decisive with the action of nudging, having clearly demonstrated her ability to do so earlier that morning. She came back with a more forceful nudge at my hand, arm and leg. I scratched her head lightly. She pushed her head back further into my hand. Contact for me was a few seconds and stop. 4 or 5 times this was repeated to a happy purring Mew. Contact ended by me getting up and walking away while she was still very much enjoying her little ritual. She also quite bought it into the idea of leave them wanting more. She quite liked that. So the outcome, here is Mew after about 35 days. And this is Mew who previously, I didn't even see her when I went to the consultation. She was hiding, and frankly I was respecting that. There she is. And the relationship continues to flourish as they learn about and from each other. They learn how to relate to each other. And her confidence is increasing, and so is Sarah's. And the interactive style should give it a low intensity, and Mew is initiating it. No further signs of anxious behaviour.